Hi, my name's Frank Meyskens. This is my wife, Linda Meyskens.
Okay.
I'm director of the University of California Irvine Comprehensive Cancer Center, the Chow Family Comprehensive Cancer Center. My interest in poetry really started during my third year of medical school, probably to deal with the various tremendous emotional burden of learning to become a physician and dealing with sick and dying patients. And I wrote extensively during that year, and then near the end of the year I put my pen aside, and I did not write again until a particular patient about 6 years ago punctured my kelvar and started the bleeding process again. Over the past several years, this has led to writing quite a few poems, which resulted in my first book of poetry, which I called Aching for Tomorrow, because both physicians and their patients ache for tomorrow during this process. What I thought I'd do is read a few of these poems. In particular, we start with the first poem that I wrote back in 2001. That poem was really precipitated when I was on the ward as an attending, and this patient was 27 years old, and she really got to me. And this poem is called Ripped. I thought I could be a hero, but you defeated us all. For what was growing inside you had never been seen before. Every day you waited, we dithered and intellectualized, and it grew, consuming you, 4 times a blasting, but too late. You wanted so much to live, more than your 28 years. But almost a year ago now, you went and died. You never knew that you ripped my heart out. How could you? You now, with belladonna eyes. My book is divided into 4 sections, and this is the first poem in the first section. The first section is called Close Encounters. The second section, Passages. The third, Eulogies and Elegies. And the fourth, Reflections. The first section, called Close Encounters, really deals with patients and their doctors, or patients and their caregivers. And I try to write as if I were a fly on the wall. Most of these poems come from a series of events or patients, and I thought I'd read a few of the poems from the Close Encounters sections. The second poem is quite simple, and the message is quite clear, and it's called Send and Receive, and it's a dialogue. It's only a little spot. I have cancer. We can get it all. They're going to crack my chest. The radiation only produces a little sunburn. My neighbor got fried. The chemotherapy isn't bad. My mom barfed for days. It's just a small shadow on your spine. I'm going to be paralyzed. I'm going to have pain. It seems to have spread to your liver, but there is this new drug. I'm going to be a guinea pig. I'm going to die. One fact, one reality, two truths, one sent, one received. Sometimes patients don't realize how physicians view them, or what their expectations are. This is from the viewpoint of the patient and what the expectations might be, and why sometimes it's so hard to be a physician when those expectations are put on you. This one is called Savior. Today was the day that you told me the diagnosis had changed my life forever. Pushed, plummeting from an airplane, my chest bursting, lungs gasping, skin seeping cold sweat from the words that you have spoken. Hit and run by a Hummer, my body flying, muscles frozen, skin crusting over with ice from the sounds that I have heard. Squeezed by the vice of not knowing, my heart stopped, life ending, skin prickled and graying from the roar in my head. Your words, a sucker punch, brain stupefied and paralyzed, now at military attention, awaiting your command. My silence is not acquiescence, for I am not a screamer. These white walls are not a harbinger of death, for you are my Savior, whether you want it to be or not. One of the hardest things for a patient to hear is that their disease is relapsed. Occasionally it's really quite dramatic, and that's what's described in this particular poem. It's called Relapse. I meant the words to be gentle, but they hit you like a cannonball through soft jelly. Your eyes grew wide, and you began to shake. Like a sapling in a hurricane, you bent and almost broke. Why me? It can't be me. No, not me. I'm cured. And the words tumbled in a steady stream, a torrent of emotion, of hopes and dreams. And all we could do was watch and listen as your life shattered. And my wet eyes were not for you, but for me, wondering if I had somehow lost my calling. The crushing in my chest told me it wasn't so. Not a miscalculation of aim, just too much to hear. Some words so awful that they can break men's backs and atomize a soul.